Hello, and welcome to Behavioral Health Innovations, a conversation co-presented by Ascension, Illinois. My name is Angel Moore, and I am the Special Events and Committees Manager at Community Health. Community Health is one of the largest volunteer-based free health centers in the United States. We provide primary and specialty care, prescription medications, mental health and dental services, health education, and lab testing at 3 locations in Chicago. Community Health provides all of these services to low-income, uninsured, and underinsured adults at no charge. We do this with the support of over 1,000 volunteers, partnerships with dozens of institutions, and donations from generous people like you. Thank you for being here and for supporting Community Health. I would especially like to recognize our many sponsors who are supporting this year's All-In series, including Baxter, Lundbeck, the Joseph and Bessie Feinberg Foundation, West Monroe Partners, and many others. I encourage you to visit our website, allin-chicago.org, to see the complete list of sponsors, read the bios of our incredible speakers, and check out the rest of the month's events. Finally, I want to recognize this year's All-In Executive Leadership Council. We have the privilege of having 2 outstanding leaders serving on the council this year. Their great insights and support have been instrumental in bringing this year's series to life. Thank you to Dr. Suzette McKinney and David Smith for your contributions this year. The goal of the All in Chicago series is to bring together leaders from many different industries and segments of our population to talk about how we can work together to ensure every resident has access to the right care in the right place at the right time. Community Health has been hosting all-in events discussing access to healthcare in Chicago since 2015. COVID-19 shone a spotlight on many health inequities in our city, and it is essential that we learn from the pandemic and continue the discussion to strive for greater health equity throughout Chicago. It is my pleasure to introduce our guest for today's conversation, Crystal Gary. Crystal is the Chief Advocacy Officer at Ascension, Illinois, our co-presenter for today's discussion. Crystal is a health policy expert and strategist who has dedicated her career to improving healthcare policy and transforming healthcare delivery systems to achieve better and more equitable health outcomes. She has an extensive record of leadership within public and private sector organizations and has served as a trusted advisor to governors, cabinet secretaries, and health system leaders. Joining Crystal for today's conversation is Kevin Ahrens. Kevin is an experienced behavioral healthcare executive with a demonstrated history of working in the hospital and healthcare industry. Kevin has a strong passion for driving quality services while managing the multiple facets of balancing the operational and clinical strategies. Through his decades of service, he has continually met the ever-changing demands of the behavioral healthcare industry. He is the Regional Director of Behavioral Health at Ascension, Illinois. Thank you for being here, Crystal and Kevin. Before we get started, I just wanted to remind those of you watching that you can submit your questions for us using the Q&A function at the bottom of your screen. Feel free to write in questions at any time, and our guests will address as many as they can during the program. With no further ado, Crystal and Kevin.
Thank you so much, Angel. Hi, Kevin.
Hey, Crystal, how are you? Thank you all. Thank you for that lovely introduction. Happy to be here with everyone today.
Yeah, so I'm really excited about this conversation. We've been able to have a couple of prep sessions on this, and I really wanted to start, as Angel said, the COVID-19 pandemic really shone a spotlight on a lot of the challenges in our healthcare system. And particularly when it comes to mental health, I think everyone agrees that the last 2.5 years have been very difficult for our mental health, and particularly difficult for certain groups. So I really thought it would be helpful to start with, what have you seen change over the past, 2.5 years? What's different today in, kind of your practice than 2019?
Yeah, and Crystal, that's a huge question, right? Is because my first answer, the simplest answer, is, well, everything has changed, and I think a lot of folks on here and providers on here would most likely agree. But then we also have a lot that has stayed the same, and so I think in looking at it, healthcare has been shaken up a bit, and mental health has become just more. We are more aware of it as a community, as kind of the masses, if you will. It's not that it's new in any way, that there's mental health concerns. It's just, I think there's been increased visibility of that. And as you had said, the pandemic has certainly shined a light, to that, of, the coping skills that we all once had, maybe weren't an option anymore. If, it was our instinct to get out and, do things and to, be a part of different communities and travel, whatever it may be. And essentially those options and those opportunities were removed, if you will, and we had to try to find new ways to do it. Just as a healthcare provider, we had to try to find new ways to deliver care to people and to do so safely. It's, I think one of the things that we've seen with the pandemic is just the increased visibility of human suffering, if you will, and whether that's, within, from the mental health perspective and, just what we understand and what we know. We've learned to question a lot. We've learned how to learn new things, if you will. I think my learning curve in the last 2.5 years, it has been, very steep, and the things that I didn't know I had to know, I started to have to understand. Excuse me. We've, had to understand infectious diseases, more depth than what we've needed to have, and which is, while we've always had to practice strategies, but now we've really had to, truly protect ourselves. And I think we've had to put that protection on and put those actions to work for it. That, literally masking ourselves for it. And the question is, what did we hide behind, with that in regards to some of those things, and what were we allowed to, we talk about the COVID pods, that we had, and everyone kind of creating the people that they could stay with that we knew were safe, in it at the beginning of quarantine and all of that, and knowing that, you become in the environment that you're in enhances you, or, distracts you, if you will. And so I think it's, it's hard to say what's changed and what's different in a small amount, that's there. I think, to me, just what I've seen is that more people are talking about mental health. More people are talking about the whole person in regards to it, and understanding that mental health is part of the whole person. We all experience it. It's not necessarily, we talk about it from a pathological component is different from just our to those that are non-pathological, if you will, in regards to it. Emotions are within the continuum, right?
Yeah.
So
no, I definitely agree with that I think there's a lot more visibility around mental health, and a lot more people are talking about it. And in some ways, maybe that's a bright spot of the pandemic is, that whole it's okay to not be okay.
Right.
Kind of became a little bit of a mantra, and
Yeah.
just the overall awareness that this is something that's affected. I mean, COVID affected everybody, and the anxiety around it, the challenges around it affected everybody. And so, it really did in some ways normalize, that fact, and normalize that everybody has, mental health needs. And in this moment, particularly, everybody has that. And so there's,
Right.
An opportunity to really acknowledge that and to really lean into it. And I'm glad that you mentioned, the COVID pods, because, that is one thing that for me personally, has been different and a little challenging, is that there's a lot of attention has been paid to the isolation phase of COVID and how hard that was on a lot of people, which it was, no question. And sometimes it feels like we, haven't necessarily done a very good job of naming, that societal trauma that we all live through, and particularly that we're still living through, because now we're moving into this kind of post-pandemic world that honestly sometimes feels even harder to me. And because I'm an introvert, so the isolation phase was really hard for extroverts, right? But I'm an introvert, so I was kind of perfectly happy in my little pod during the pandemic, and then suddenly it felt like I got pushed out of that, quite frankly, before I really felt ready, into a world that had changed significantly and was still in a lot of chaos. So it was, hard for me to, kind of figure out, okay, how do I navigate this now? And also a little hard to admit that I was struggling with that, because there's this pressure, or it felt to me like there was this pressure that we're all supposed to be happy that we could finally get together in large groups, or all supposed to be happy that we're no longer wearing masks. And yet, it was very anxiety producing, in me. So, there was, really, I would say even earlier, probably because we had that big Omicron wave earlier this year, beginning of this year. I would say earlier this year, there was really, that piece of it for me. And, it makes me kind of wonder, what do you think this post-pandemic period, I'm kind of putting that in quotes, this
Yeah.
post-pandemic period is, means for, mental health, and, kind of how do we really, balance the fact that it can still be anxiety producing and difficult for people.
Yeah. Well, and I think, that question is great, right? Because it's that, well, what do we think? And as you had talked about, it's that, for many, it is that anxiety of, coming out of the pod, or that anxiety of not having, the big, aspects that worked before, having, we all are walking into a completely different environment, that the statement of, no river is the stepped in the same, on it, because just by stepping in it, you change that. And I think if, kind of like with society, as we get into this post-pandemic piece, we're not stepping into the same world that we went into isolation at. It's a very different world. There's different perceptions, and there's been a lot of growth, in some respects. And there's been a lot of, like I said, just before that, the visibility of suffering is more prevalent as well. And so how do, we all step out into the community? How do we show up, right? Is, really the question. And then as providers, as people that, have really dedicated their lives and their passion to caring for others and helping others in a time where everybody needs help, it's then managing that, that could be overwhelming. That could be, you could have great gratitude and count your blessings that this is, essentially your gift or your passion. And now you have this wonderful opportunity while you don't want to see anyone suffer. How, how do we balance that? And, how do we, still keep ourselves okay, and safe, long ago, and I'm sure many have heard, that aspect of the, emotional bank account, and as you provide and as you're a caregiver, you give so much that you're making all these withdrawals on your, on yourself, and, the importance of replenishing that, it is there. And how do you not feel guilty when you have to step away from caring for others? I know many nurses or, many providers and social workers that, almost had a hard time leaving work because there was so much to do, in helping others before it. And so finding that balance is difficult. And I think it's going at it together is going to be what helps us.
And I have to say, one of the things that I really appreciated about, working at Ascension, Illinois during the last couple of years is you and your team were so good and so intentional about really reaching out internally as well as externally. So, kind of caring for the patients, caring for the people that we serve, but also, caring for associates, making sure that, we had support groups available and that people knew that those resources were available internally, making sure that people knew that it was okay, to admit that this is a tough time for, for all of us, and normalizing that you have to have that self-care. You have to, when the plane is going down, you have to put your oxygen mask on first before you put it on somebody else.
Right.
And, being in that culture, personally, I felt, very supported. And so want to just take this moment to personally, kind of thank you and your team for that. But also, you mentioned that everything has changed, right? And so the way that we deliver care and the way that we respond to the needs that we're seeing and the people that we serve today, is just necessarily different. And so I wonder if you could take a few minutes and just talk about what are some of the things that Ascension, Illinois has done, and is doing in order to, change some of the ways that we are serving people with behavioral health needs.
Yeah, well, and I appreciate the statements that you made in regards to what Ascension is doing to support the associates and bring that front of mind, if you will, of caring for each other, caring for yourself. That the difficult task of helping the helper is certainly a thing, and it's hard for helpers to accept help, sometimes as well. And I think Ascension has done a great job of putting compassion as really, the priority, and whole person care as the priority. And when we say whole person, it's kind of the whole person and all people aspects to it. So it's not just those we treat, it's each other when it comes to that. And, checking in on one another, and having that support group, having, what we've referred to as kind of the work best friend, model as well, of how do we go about making sure that everyone is connected and everyone's purpose is being able to be executed, as well. And that, making sure that the right talent is at the right tables when it's needed. And, to your point, Crystal, this is never done alone. This is done with, great collaboration and great partnerships, with, the folks outside of Ascension, even, and treating the people, that we treat, and making sure that, we are all in, doing our best to be in good standing to continue to care for that. And, Ascension, I think, has done a great job of that, to maintain quality care as well at the top of this. There is a number of instances or kind of aspects of which, we didn't have the ground, we didn't have the game plan or the blueprints, for how to do any of this. So we had to figure it out, together, and, start from scratch. And there's certainly times where, I know I'll only speak for myself, is that I didn't feel like I had the competency, to do some of what needed to be done, because, none of us had dealt with this before. How do you stand up, the ability to care for folks and test folks and get vaccinations to, everybody? How do you do all that? And that's just talking about COVID. And then how do you manage that fear and the kind of reaction to it? I loved what you had said, that societal trauma, that's experienced. And that could be, you can talk about COVID, you can talk about any just kind of that communal experience that's there, whether it's a micro or macro level on it, that has an effect on all of us, and how we respond to, not just individually, but how we respond to our community, how we respond to our system, as, an employee, what is that like? Our definitions, I think, or, how people see us has certainly changed, because, while we have to mask, there's a lot of things you can't mask when you're doing this, because you have to be vulnerable to make the right change on it. And, what I was grateful for is, Ascension does create that work environment that you can go in and be vulnerable and say, I don't understand, I don't know how to do X, Y, or Z on it. And then having the resources to support it so that the right decisions to meet the needs are presented and are an option. For that, we've focused on quality and still moved ahead on a lot of initiatives for patient safety, as well, and still kept that as the focus, and didn't use, the pandemic or not knowing anything as any excuse to not do what we're here to do, for it, right? I think everyone's heard some level of the analogy of, we were, building the plane as we were flying it, or we were building the bike as we were riding it, and, whatever analogy at whatever level, suits you, but yeah, there's certainly times I felt like, we were, rubbing toothpicks together to try to make, something amazing. It wasn't, trying to figure out how are we doing some of this, work, and we couldn't stop moving, was simply the point. We couldn't stop doing what needed to be done, and had to, but at the same time, do something new. So there was no start or stop. It just became this fluid piece to it, to where we weren't able to compartmentalize, any of this anymore. And that makes it difficult, is because that's how we, the human brain wants us to compartmentalize and, sort things as, within the polarities of good and bad, or comfortable or uncomfortable. And, how do we sort that through to understand that, maybe there's not polarity, maybe there's just more commonality that we need to embrace on that, and meet that commonality with compassion, from all sides. And I think Ascension does a nice job of pushing that through.
Yeah. And, you talked about caring for the whole person, but also thinking about the whole spectrum of need, right? So I know across our system, We have community behavioral health. I know in some of our hospitals, like our St. Mercy, or not St. Mercy, our Mercy Hospital, has launched a crisis stabilization unit.
Yeah.
Where you are right now today at St. Joe's, we've seen an increase in eating disorders, and so we're looking to expand our eating disorder clinic. So could you talk a little bit about kind of programmatically what some of the
Yeah.
things are that we're doing?
Yeah. So, and as you said, the Mercy Project out there is being able to treat folks and have improved access of need within the crisis state unit, and so that folks don't have to come in fit into the emergency department necessarily if they're looking for being able to just get that mental health need and separate some of those things as well. So I think again, it's a meeting of the community need as we look at it and looking at what our volumes and issues are. That Ascension has done a nice job to be able to do that. That helps to whether it's the police departments and how they respond and where to bring people is very that's a supportive aspect. As you'd mentioned, the eating disorder piece, I think from eating disorders to addiction aspects, that's again one of the things that COVID has shined a light on. Makes it people attempting to figure some of these things out, understanding that past mechanisms or kind of coping mechanisms and strategies maybe aren't working, and to know that there's help and support to move past that, and making sure that our doors are open to and that we're holding the door open for people to come and get help. And eating disorder expansion from what we already have at Alexian Brothers is a nice indication of that there's a continued need, and that we're going to work to meet that community need and partner with those that are also treating all of us on that. So I think those are great examples of expansions that we're doing for that within behavioral health. So absolutely. So I think Krista, one of the things that pops to mind for me is, in your role that you have, what are you seeing happening, within the policy world, if you will, around behavioral health on it that, maybe helps, kind of shape some of this in regards to, what, as we define some of those needs, what changes are you seeing or do you anticipate?
Yeah. So I would say one of the things that I'm really excited about and seeing, change in the policy world is telehealth and advances in digital health. So, and that's obviously not just in mental health. During the pandemic, the ability to provide telehealth services was, there was a huge spotlight that was shined on that. It was so important. And we learned a lot of things there. And, being able to provide those digital care options just has so much promise to improve access. And also, I think, as to reduce stigma as a barrier, because it can be so intimidating to walk into a mental health provider's office, even impossible for some people just from an access perspective who don't have transportation or the ability to take off work or step away from their caregiver responsibilities. So being able to do that is really important. And from a policy perspective, during the public health emergency, they allowed for a lot of additional flexibilities in telehealth that hadn't been there before to allow, more providers to be able to provide that service in, more places, to have more originating sites, and quite frankly, to have, the reimbursement to be able to support that. And so, now that we have these lessons learned, it's been great to, see, and I'm encouraged that from a policy perspective, there's movement to codify those flexibilities and to allow to continue to be able to provide, more services via telehealth. And, I think, as you had mentioned, there's just a lot more awareness and visibility of mental health needs and a lot more focus. And that's true for policymakers as well. So, I'm seeing, just the continued conversation and continued fight for mental health parity. We've had mental health parity for several years, but as you and probably a lot of people on the call know, having that mental health parity on paper doesn't necessarily mean that the intent of that law is being felt and demonstrated in practice. And so there's, I think, a lot that's being discussed and looking to make sure that we're actually, that people are actually experiencing mental health parity in their insurance coverage, and that there's, greater enforcement around that. So in 2020, Governor Pritzker, announced fines for health plans, for the first time under the state's Mental Health Parity and Addiction Equity Act. And so at least that's a signal for health plans that that's something the Department of Insurance is looking at, and conducting market conduct reviews around. And then also the General Assembly established a Medicaid Managed Care Oversight Commission. That's another thing I'm optimistic about, is really making it clear that from the General Assembly's perspective, that they also will be watching, Medicaid managed care plans to ensure that they are providing medically necessary care, and that's including mental health parity and mental health services. And then at the federal level, there's also a lot of focus and a lot going on. Legislation is in the works to enhance funding for behavioral health care, and again, to support that, parity, both parity of coverage and also parity of reimbursement, which of course, as we know, is very important from a provider perspective. And I would say, also in the executive branch. So, legislation is important, but it's the executive branch where, kind of regulation and enforcement happens, but also where there's a lot of opportunity to support innovation. So, earlier this summer, the Department of Health and Human Services announced a Behavioral Health Recovery Innovation Challenge. And, they've invited, or they did invite providers and organizations to really submit how they are being innovative in providing recovery services. And, that's something that is an opportunity to encourage and reward innovation, but also to continue to raise awareness and to share best practices that are out there, and hopefully be able to expand on those and replicate those. So we should be hearing more about that later this month, actually, who the winners of that innovation challenge are, but also being able to see who all the finalists are and what some of that great work, is moving forward. So those are some of the things. And, I'm really, kind of concerned moving forward about funding. Funding is always a challenge, with government at both the state and federal level. As well as staffing, staffing shortages, we're experiencing them, but everyone's experiencing them, and government agencies are as well. And so that, hopefully, I have not seen as much talk or investment about investing in that pipeline for mental health professionals. And that's another thing that, that I hope to be advocating for, and hope to see, more focus around, because we have the 988 crisis line, that launched earlier this year, that is, will make it easier for people to, kind of have a one-stop shop to reach out when they have mental health needs, but also there has to be a place to refer them. There have to be providers, for them to be sent to. And we want to make sure that there's true access out there for the people who really have those needs. And, of course, what goes along with that, greater awareness by policymakers, is that, one of the things that's motivating that awareness is the attention being paid to violence and the perceived connections between mental health and violence, and particularly the mass shooting incidents, that we hear about. And it feels like we're hearing about a new mass shooting reported in the news almost every day. And of course, in the healthcare world, we know that, we've also been seeing an uptick of violence and threats of violence against healthcare workers, in across care settings, but particularly in emergency department settings. So, Kevin, I'm wondering how would you suggest that we consider these incidents in the context of community mental health overall?
Yeah, and that's, Crystal, it's a tough question, because as you said, there's, sometimes the pairing of those two, like, the mental health and the mass shooting. And, because as we experience these things, the natural response is to attempt to understand it, but at the same time, to ask, yourself to understand those actions, that are so devastating and tragic, of, often the unanswerable question, if you will, is, well, why would somebody do that on it? And, to make it, attempts to make it make sense. And it's hard to do that. It's hard to, make it, to put that out there. We want to make sure that, we have solutions to it. I think, there's a lot of, conversations happening about, if we monitor this better and, look at this. And, I think the 988 is just access to care, the reducing of the stigma, the ability, as you had said, to talk about it's okay to not be okay, for it. That, when we look at the mass shootings and the devastation of all of that, paired with suicide, to that as well, and the risk that everyone essentially encounters with some of this. It's, it is just that aspect of being available, and having, not just being available, but then providing the appropriate treatment that is effective treatment on it. And I think that's where Ascension, also does a nice job of using, evidence-based practices that are, hit on what can be successful, with folks. Appropriate assessments, is huge, and that's the 988. One of the initiatives is getting the right people to respond, to the right situation, essentially, right? It's 911 is going to have a police officer, and the police officers are trained, to deal with certain situations, and then, mental health folks are trained, and medical folks are trained. We all have a part of that, and that's, from a police officer, the response is, ideally to create safety. The mental health professional is also to create safety, from that emotional aspect of it, and how to, get the person into care, in the right way, and making sure that those needs are addressed. And we talk about the whole person, and we talk about the behavioral components to it as well. So, yeah, a lot of the question is, how do we address that? Sorry, I have a fire alarm going off, of course, right now.
No problem. Go on mute for a second.
So,
gives me the opportunity to switch gears a little bit. I wanted to, the topic of this session is, or the session is named, behavioral health innovations. And I mean, in some ways there's certainly no substitute for the basics of behavioral health and that human connection. But, the term innovation is one that I think is thrown around a lot. And, it just spans the gamut, right? So, we just talked about the launch of the 988 mental health crisis line, opportunities to expand access, all of the new apps and digital, connection opportunities that are out there around behavioral health, and, ways to, and also just the expanded research that's out there, right now. So, new therapeutic and pharmaceutical options, to the use of, cannabis.
So I do have to, I'm sorry, I do have a fire alarm going off, and was just told I do need to evacuate.
Oh, wow.
So
okay.
I am very sorry. Let me see if I can be back in a minute. I do apologize.
No, hey, go, be safe.
This, but yes, thank you.
Well, then one of those things you just cannot anticipate. So I will go, I will continue, kind of with the question, and just some thoughts for myself. And then also, if you do have questions, this might be an opportunity to, address some of the questions that are out there too. So I see a question, many organizations have been experiencing a behavioral health clinician shortage. Is Ascension experiencing this, and how are you addressing this? So, the short answer is yes, we are experiencing, we're experiencing staffing shortages, as I think all healthcare organizations are, and that includes some, shortages in being able to fill positions in our behavioral health hospital, our behavioral health service line. How are we addressing it? Kevin's probably the better person to speak specifically to how we're addressing it. but we're continuing to try to be a little bit more creative in our recruitment, methods, but also really focusing on some of the things that we talked about earlier in the session, which is, what is our, what is our culture? What is our approach to that employee wellness, piece of things, and how we really, want to care about the, the provider, and making sure that, we're caring for each other while we're caring for others. Let's see. Can uninsured individuals access care through 988? So, again, 988 is a behavioral health crisis line. So, from that perspective of, yes, being able to call that number, when you're experiencing a crisis, have somebody available to talk to, have somebody who might be able to refer you to other, kind of other needs. Yes, that's something that, that somebody can access. It's not ongoing care, so, the person would still have to, kind of work with understanding what the person's insurance status is, and, helping to refer or connect them to an ongoing source of care based on that. Let me see. There have been controversies around 988, and that it essentially is set up to still send police to those calls, which causes additional harm, especially to people from marginalized communities. Do you have a response to this? I am not, I don't work for the 988 line. I don't have a lot of insight into, into the specifics about, when they make those determinations. So sorry, I'm not able to address that. So one of the things, that I did want to speak to with Kevin, and we might not be able to have him back, to talk about that, was, talking about the innovations in behavioral health, and, some of the research that is out there, and the new, treatments that are out there around that. So if he comes back, we might be able to speak to that, or we might be able to, provide some insight into that later. But what we were really looking to do, and how we had wanted to wrap up, is, just talking about how Kevin and I, and, for everybody who's on the line right now, can think about supporting our own mental health during, these stressful times, which quite frankly continue to be stressful. We're past the most stressful point of the, let's hope the most stressful point of the pandemic. I don't want to, jinx us, but, we're past that most, kind of critical phase of the pandemic, but there's still a lot going on, right? There's still a lot of stress in, in the healthcare industry. There's still a lot of change. Now we're, dealing with staffing shortages. We're dealing with financial pressures, and so that's one way that we can, so what are ways that we can really think about, how are we supporting ourselves while we're also supporting the people that we serve? And, one of the things that Kevin and I had talked about in our, in our prep session around this is something that we have said before, which is, one, it's huge to just be normalizing it. And that's something that we've been working to do in our own internal culture at Ascension, Illinois, is, having these conversations, talking about this in meetings, having check-ins at the beginning of our meetings, to be able to really talk about how, to really just normalize that it's okay to be okay, normalize, and acknowledge that this is a very stressful time, to really show appreciation. Hi, Kevin, welcome back. I'm glad you're safe.
Hey, all. I'm so sorry about that.
No problem.
Everyone
So
safe.
I'll wrap up my thought, and then I'm very happy to get back to you. But talking about how it's really important to also make sure that we're acknowledging, what everyone has been going through, that stress, the uncertainty, and to, make sure that we're being intentional about creating an environment of appreciation, an environment of great gratitude and gratefulness. So those are some of the ways, I think, from an internal culture perspective, we've been looking to, focus on that wellness. And then also, I think for me, personally, to also make sure that, I am doing my own part to just be, kind of transparent and honest when I am struggling. I've done that a couple of times already today to say, hey, when we kind of earlier this year, when we came out of the pandemic, that was a little bit of a rough time for me. And, I think that's important because as a leader within Ascension, Illinois, I'm able to kind of model that, not oversharing, not in an oversharing way, but, just to, again, continue to normalize, but then also to be honest about it and to be honest with myself so that when I do need some additional support or when I do need to talk to someone sometimes it can be hard, even somebody who works in this space, for me to say, you know what, I think I really, I am feeling pretty stressed right now. I am feeling some anxiety right now. I really probably should talk to somebody and just, and just kind of work through these emotions.
Mhm.
And that's something that I encourage for everybody because it's not healthy to try to think or pretend like you don't have emotions or that you don't have needs, because we all do. And, what's really healthy and important is to normalize that and to be willing to check in with yourself. And if you do have that, that need, or you are feeling that stress, to not think that that's some form of weakness, but to really be willing to have those conversations.
Right.
So anyway, I just kind of skipped ahead, Kevin, to the end because that was what I could address on my own. But now that you're back, I wanted, before we get to the rest of the questions, just talk a little bit about the innovations in behavioral health and to see if you have any thoughts on that. I mean, it's a big question. It's a big area. There's a lot going, a lot of innovations from, all of the apps and the digital tools that are popping up out there and some of those new behavioral health and wellness enterprises, all the way to research into the expanded uses of cannabis to treat anxiety and psychedelics to treat psychiatric disorders. So I'm, just wondering if you wanted to provide some, insights into, how you think about some of these innovations. What are you looking, keeping your eye on, and what are you most hopeful about?
Yeah, I think the innovation piece that's I think one of the things I am most excited about, to be honest with you, is that there is a lot coming out. As you mentioned, kind of the digital aspect, the ability to have the uh, connectivity, without proximity, if you will, is huge for people. And, that whether that's just access or to, digital communities, even so that you're with people that, are common to you and that you feel comfortable and connected to. From a treatment perspective, there's also a lot, you had mentioned a couple of them, but, looking at, some of the, TMS aspects, the other, pieces of, brain, kind of wave activity, things like that are out there, and, new ways that we're understanding the brain. From a research perspective, we have a number of research projects through St. Mary's, St. Elizabeth in Chicago, working with, early onset, schizophrenia, first onset schizophrenia. There's a lot going on, there from a research component. Just some of the things that are fun for me to look at is utilization of VR within the inpatient setting of using that to establish you, I hate to use the word kind of norms or whatever that may be, but just even if that's using VR to aid in create that calming environment, or a place where people can go and make it feel like something that's refreshing or recharging to them, based off of what their needs are, and that can create a whole new environment. And I know as I came back, I heard you talking about just having an environment that is caring, an environment that is compassionate, and is really a psychologically safe space to do that. And using innovation and using technology to do that, I think is very positive. We could also look at, but then at the same time, you could look at technology as, people use it as an escape. It becomes addictive because it does release, it has that, the same release of the chemicals, that you do become addicted to that release and the checking, on that. And, so it's finding that balance between utilizing it the right, I don't want to say the right way or wrong way, but just in the way that works for the individual on it, and helping to teach some of that. And being, from Ascension as a treatment provider, being the place that people can come and utilize, more and do, being able to, my hope is that, we are the ones that have some level of, blend of all of the things that work from a best practice standpoint to be able to be, the location that people say, that's where we're going to go to get, behavioral health help or mental health help, um, for it, because we're trying to, we are working to find out what else is there, and being part of the decision and the science, as you talked about some of the policy pieces on it, and, having an active voice there as well to try to, have those innovative conversations and collaborative conversations, to know that the only way we're going to do this is to partner, with others, and, reduce that kind of conflict. There's not enough we know there's not enough providers to deliver the care that we need. So what can we do instead? Or what can we do now at least?
So there are a couple of questions actually related to that. So let me use that as a segue into some of the questions. As a provider, what are some of the new challenges and benefits that you've seen in telehealth sessions versus in person?
Say that one more time.
As a provider, what are some of the new challenges and benefits that you have seen in providing services through telehealth sessions versus in person?
That's a great question. So for me, I will speak to, I was trained a long time ago in doing, the clinical side of this work. And so telehealth was not something that I was trained in. And so for me, I know I, somewhat struggled even with doing presentations like this that weren't in-person presentations, of like, I don't know how to adapt my material. And so, as a clinician, you can still have the conversations, but there's certainly things that you miss out on. In reading the body, the entire body language of an individual is not there. And that's something that's a skill and a tool that, as a clinician, that you would utilize before, and now you don't have that. And so now you've got to figure out, well, how to ask the questions and get to some of those answers, if you will. What makes it better, I think from a telehealth, obviously, is it's access to it. Sometimes you get to see people in their home environment, so you don't have that change. They're more themselves, if you will. They don't put up that emotional shield to say, okay, I'm going to the doctors, or I'm going into the clinic, so I'm going to present this way on it. That they, sometimes they are seemingly more authentic, and so that you get a different picture of how to help, when it comes to that, and to see the environment that folks, are living in, and being able to help them adjust, accordingly, with new information is a huge benefit that telehealth brings us as well.
That's a great insight. Another question, I work in a university teaching in the psychology department. How do you propose supporting the recruitment of students into careers in the mental health field? Social workers, therapists, psychologists, etc.
Oh my gosh, I love that question. I've asked myself that question as well. And so it's hard, I think about this a couple different ways, I guess. It's hard to guide anybody into this. I think you sometimes see the traits an individual has and possesses, and some things you can teach, and some things are just the traits that individuals have, that are necessary. And so, I think when there's compassion, that's there to find the right people to do the work, is hugely important. And, as a professor, or, as a teacher, in that sense, how do you support individuals to follow, what their passion is and what their skills are, for that. And I think, I had a conversation with a group about a month or so ago of younger kids, and, there's classes now, where they're teaching more about mental health. So there's more of an understanding. And I look back to, on a high school level, whether it's a health class or anything, they're talking about mental health. And as we said, this is more visible. These were not classes that we had, when I was in high school on it. So that, the kind of the younger generations have a leg up on us in understanding some of these things and being able to talk about these things in group settings, where we talked about them, if we talked about them, and just individual one-on-one settings. So it's, I would love to see just different exposure at younger ages to helping people and understanding, that people do need help. It's not a, managing mental health is not a one person, it's not just your responsibility for your own. In a way, you can ask for help, I think, and, creating an environment that people understand that those are jobs, right? That, people do for it. So, I don't know if that truly answers the questions. I kind of fantasize about high school level, internships within mental health, within the mental health field, and so that they can have some exposure to that. I think that would be, a great way if we can find some way to balance that.
All right, we just got the 5-minute warning. So there's several more questions here. You had talked about a little bit about partnerships and how, we can't all do this alone. So there's a question about how is Ascension investing in access to mental health services in communities and ensuring you collaborate with community partners to create the right kinds of innovations?
So this is done, I think, a lot through some of, the data drives some of these decisions, if you will. So when we look at, what are we good at and what do we have areas to improve on, to understand that we can't do each of these, if you will, but that we do need partners that are, more of the experts. So, being able to, whatever that may be, whether that's working with, PCPs or your, general internist physicians, working with some of the other mental health community agencies, that surround and are part of our community, that, there are aspects of treatment that they can do and aspects of treatment that we can do, and just being able to find that beautiful complement, if you will, of those on it, and knowing that, we have plenty of service that is needed out there for it. So from an Ascension standpoint, that's a lot of what we're doing, is working with other healthcare systems, and having that transparent dialogue to say, here's what we do, and here's what our gaps are, and who's willing to fill the gaps in the interest of the community as well. So there's a lot of kind of active projects that we're working on, and as you had mentioned, Crystal, about some of the innovative pieces with the state, and some of those awards coming out, that we're a part of those conversations.
And then there's one other question, and actually there was a question that I had tried to answer previously, but didn't do a great job of. So the question is, is there a charge for counseling? And then the other question had been, what about people who are uninsured? So people who are uninsured who might, call the 988 line, how do they get access to the services that they need?
Yeah. So, I mean, my gosh, that's one of those per situation questions. Is there a charge for counseling? Yes, there's a charge for counseling. The how is it done, or how is it approached if there's, if you don't have insurance to from it, is, yes, there's certainly systems, and that's part of our mission, is to not turn, folks away, and to try to get them into, the right care at the right time, and then addressing, the other needs outside of just the healthcare needs. If, access to, insurance or access to these things, those are some of the hurdles that we do try to overcome, with those that we serve, and, seeing what they can get enrolled with, and what other resources are out there, and, other partnerships that we have with, folks, like with the community health, as well, and, the services that are there. And that comes down to a lot of, whether it's, donations, from folks, or, it comes down to even some of the public access to care, pieces. So like I said, it's a hard question to answer, because it's each person's exposure or situation, might need something a little bit different.
Well, Kevin, it's been such a pleasure to be able to have this conversation with you today. I know I've even learned things in this conversation that I hadn't even learned in our previous conversations. So I think it's great. And I'm so glad that the fire alarm, ended up getting worked out and that you were able to come back and be safe.
I was going to say, talk about, sitting here and thinking that we have planned everything out so that this runs smoothly, and then being, something thrown into the plan that we have to adjust to. So Crystal, thank you for being flexible and adjusting and covering for it as we, like I said, make sure that we are all, good and safe here. So
Absolutely.
so almost poetic, that happened, I think. So, but thank you so much.
All right. And so I don't know, Angel, are we turning it back over to you, or are we just wrapping up?
Yeah, thank you so much, Crystal and Kevin. It was a great conversation. Thank you both for being so flexible. I know how much you planned for today, and a fire alarm is definitely not something anyone ever plans for. So thank you again. As I mentioned earlier, today's program was brought to you by Community Health. Any donations you make today will support Community Health's mission to serve those without essential health care. Please consider making a contribution now to support Community Health. Instructions should be appearing on your screen, and I'll ask my colleague to drop a link in the chat for you as well. On behalf of the staff, board of directors, and volunteers at Community Health, I want to thank you all for being part of our All In Chicago event series. I hope that you're leaving today with ideas for how we can work together to make the vision of access to care for all Chicagoans a reality. We have 5 more events coming up throughout the rest of the month. I encourage you to check out our website, allin-chicago.org, to learn more about them, the great events coming up, and register to be all in. We have a critical role to play in this effort. Thank you for being a part of today's event.